Namaste. I am Dr. Sukriti Bhalla, Senior Consultant Intervention Cardiologist at Akash Healthcare Super Speciality Hospital, New Delhi. So today I would be discussing about ambulatory BP monitoring and its importance. Ambulatory BP monitoring provides a 24-hour account of the patient's state, and it's useful for diagnosing primary and secondary hypertension and differentiating it from the white coat and mass subtypes. It is accurate in predicting the risk of cardiovascular disease and mortality. Blood pressure level measurement using home or ambulatory BP monitoring is recommended in patients with office BP classified as high normal blood pressure or grade 1 hypertension, where systolic blood pressure ranges from 130 to 159 millimeter mercury and on or diastolic 85 to 99 millimeter mercury. Ambulatory BP monitoring provides the average of blood pressure readings over a defined period, usually 24 hours. The device is typically programmed to record blood pressure at 15 to 30 minutes interval, and an average blood pressure value is useful providing daytime, nighttime, and 24-hour monitoring. A diary of the patient's activities and sleep time can also be recorded. Minimum of 70% usable blood pressure recordings are required for a valid ABPM measurement session. The ABPM values are on average lower than office blood pressure values, and the diagnostic threshold for hypertension is more blood pressure of more than 130-80 millimeter mercury over 24 hours, more than equal to 135 or 85 millimeter mercury for a daytime average, and more than 120-70 or more for the nighttime average, all equivalent to office BP of 140-90 more or equal millimeter mercury. So, what are the advantages? It is a better predictor of hypertension mediated organ damage than office blood pressure. A 24-hour ambulatory BP mean has been consistently shown to have a closer relationship with morbid or fatal events, more sensitive risk predictor than office blood pressure of cardiovascular outcomes such as coronary morbid or fatal events and stroke, can identify white coat and masked hypertension, stronger prognostic evidence, a good nighttime readings can be taken, measurement in real life settings, additional prognostic blood pressure phenotypes, the abundant information from a single measurement session, including short term BP variability, can be noted. Usually, not many disadvantages, but yes, can be a little more expensive and sometimes limited availability, and sometimes be uncomfortable for a blood pressure device to be worn for 24 hours. The ambulatory BP monitoring has an indispensable tool in diagnosis and management of hypertension and its therapy. The recent guidelines from ESC recommend the diagnosis of hypertension should be based on repeated office BP measurements or an ambulatory BP monitoring if economically feasible. The analysis of various indices of ABPM graph, such as the hyperbaric index, diurnal index, tipping, and other indices, can provide useful information about the prognosis of the disease, such as hypertension, diabetes, CKD, and so on. It can also be used as a monitor the therapeutic efficacy of the antihypertensive treatment. In addition, ABPM is the single most effective tool to diagnose white coat, masked, and nocturnal hypertension and can help direct the treatment in such patients when required. Overall, ABPM readings can guide towards the prognosis of underlying organ damage and can be a useful predictor of cardiovascular risk. So, thank you so much for your patient listening.